This is chapter 21 dealing with Rickettsias, Chlamydias, Spirochetes, and Vibrios, the remaining bacteria. Rickettsias are very small. They have just a very tiny amount of peptidoglycan in their cell wall. They are obligate intracellular parasites. There's 4 genera that can cause diseases in humans. Various genus: Rickettsias, Orientia, Escherichia, and Anaplasia. Rickettsia is non-modal. It's aerobic. As I said just a bit ago, it is bacteria. It's transmitted by arthropod vectors. So the bacteria tend to live in the cytosol of the host cell, and there's 3 different species that can cause human infections, and all 3 will be transmitted by arthropods. Rickettsiae is the causative agent of Rocky Mountain spotted fever. It is the most severe and also the most common of the rickettsial illnesses. It is ticks that will transmit the disease, the causative agent, from rodents to humans. Usually what will happen is an individual, when they're infected, they will develop a rash on their arms, on their trunk. It can be treated with antimicrobials. The main thing is then to prevent ticks, prevent that arthropod vector. This map shows the number of cases of Rocky Mountain spotted fever in the United States from 2002 through 2014. If you notice, I just want to say, even though it is referred to as Rocky Mountain spotted fever, the majority of the cases actually are in the southeastern part of the United States and not in the Rocky Mountains. It's just that's where it was first identified. Rickettsia paraschi causes epidemic typhus. With that, you'll have a high fever, a rash, depression, and it is the human body loss that will transmit the bacteria from the host, other animal hosts, to humans. Humans will be the primary host. This is seen more in areas where it's very crowded and there's unsanitary conditions. It's very prevalent in places like Africa, Central America, South America, and China. It can be treated with certain antibiotics. There is a vaccine that's available for very high-risk populations. The main thing is to have good personal hygiene is the best prevention. Rickettsia typhi causes murine typhus. With that, you'll have fever, headache, chills, muscle pain, nausea. The rodents are going to be the main reservoir, and it's going to be fleas that will transmit it between the animal host and the humans. Usually the disease is not fatal. It is endemic in every continent except for Antarctica. It can be treated with antibiotics. And once again, if you can avoid the fleas, then you would avoid getting the disease. One of the other genera is Orientia. I'm going to admit I'm not even going to attempt to say the species name on this because I know I'll get it wrong. This used to be classified within the Rickettsias genus, but it has been given its own genus now. Mites are going to be the reservoir and the vector, so they will transmit the bacteria between rodents and humans. It can cause scrub typhus, which here again you're going to have fever, headache, muscle pain. Sometimes you'll have a rash. This is endemic to Eastern Asia, Australia, and India. You can treat it with antibiotics. Once again, if you can break that transmission, break the link with that vector, and then you can prevent ever being exposed to the bacteria. The other 2 genera are considered as emerging diseases in the United States because they're relatively new. They both will resemble Rocky Mountain spotted fever, however you don't have the rash. Ticks are the vector. There's different developmental stages of it. You can use antibiotics to start treatment, ideally as soon as possible, so that you don't end up with other complications later on. So once again, avoid the ticks. And this is showing the geographic distribution in the United States. And a summary table of several of the Rickettsias in the characteristics, what the primary vector is, what the reservoir is, what the disease is. Chlamydias do not have a cell wall, and so they originally thought to be viruses. They, however, have been changed like, no, they're not viruses, they are bacteria. However, they don't have peptidoglycan in their cell wall. That was kind of the confusing nature of them initially. They will grow and multiply only within vesicles that are contained within the host cell. So they do have kind of a unique cycle to them. They have two forms. One form is called the elementary body, the other is the reticulate bodies. And both of these forms can be found within a host cell. There are different species of these. Chlamydia trachomatis has a very limited host range. Most of the host times the host will be humans. However, there's one strain that can infect mice. How do you get it? Usually you have a cut, abrasion, and it's able to enter the body and penetrate through that. It can infect various mucous membranes, including the conjunctiva. Chlamydia is the most commonly reported sexually transmitted disease in the United States currently. It can be found as an eye infection in poor communities where there's not a lot of good personal hygiene or sanitation, medical care. In terms of the sexually transmitted diseases, lymphogramia and venereum, normally will start as these swelling buboes, typically in areas by the lymph nodes. They will enlarge, they can rupture, and then actually start draining and produce these open sores. For women, usually the infection is going to be asymptomatic. However, for males, you will see the symptoms. If there is a reinfection after the initial primary infection, oftentimes it will lead to a pelvic inflammatory disease. So back showing the bulbous on a male, that swelling can rupture and then drain, and then the infection spread. Another disease is trachoma, which is an eye infection. It is the leading cause of non-traumatic blindness in humans. You can end up with scarring on the conjunctiva. And this causes the eyelashes to turn inward towards the eye instead of away. Because the eyelashes are turning in towards the eye, it can then scratch the cornea. And over time, this continued scratching eventually can lead to blindness. It can also, by scratching it, lead to abrasions that can lead to infection in the eye. Usually, infection is going to occur during childbirth. This shows an eyelid that was infected, and as you can see, you have the turning of the eyelid and the growth, and this can be treated by surgery to remove that flap that is now over. So how would you diagnose this? By finding the bacteria at the site of infection. You can treat it with antibiotics, as well as if there's any deformities, you can, as I said, perform surgery to remove, as the previous picture, that flap that has moved over the eye. In terms of prevention, blindness can be prevented if you start antibiotic treatment as soon as possible. And then as far as the sexually transmitted infections, abstinence is going to be the best prevention. In terms of diagnostics, this is showing a direct fluorescent antibody test. So the glowing red indicates, yes, that's where the bacteria. Campylophilia pneumoniae can cause bronchitis, pneumonia, and sinusitis. A lot of infections in some individuals will not be as severe. It'll just kind of be tiredness and this chronic cough that seems to never go away. You can treat it with various antibiotics. It is difficult to eradicate and prevent it because it's pretty much everywhere. Chlamydias can cause ornithosis, which is a disease in birds that can be transmitted to humans. Typically, it will cause flu-like symptoms. People who are going to be at higher risk for this obviously would be those individuals who would be handling animals, especially birds. Um, if you're handling birds from a professional standpoint or a pet bird, be careful, be able to recognize symptoms in the birds, and just proper handling to prevent infection in you. So this table is a summary of the Rickettsias, Chlamydias, Mycoplasma, viruses, and showing the different features, comparing and contrasting them. Spirochetes are bacteria that tend to be very thin. They tend to be coiled tightly and in a helical shape. They tend to move like a corkscrew fashion. This has to do with the axial filaments that are wrapped around them. The benefit of this corkscrew type movement is that it does allow the pathogenic spirochetes to be able to kind of burrow down into your tissues. There's three main genera that can cause human diseases: Treponema, Borrelia, and Leptospira. Treponema, the most common one is Treponema pallidum. This is the causative agent of syphilis, which does occur globally. Transmission is usually by sexual contact. One of the problems is for females, once again, symptoms usually are not visibly seen, so they're asymptomatic. This shows a slide with, as you can see, those darker corkscrew shape. Those are the spirochetes. That's the treponema. This graph on the upper portion of the slide shows the incidence of cases of syphilis here in the United States. You can see it was relatively high, and then in the early 50s to mid 50s through about 1960, there was a dramatic decrease, and then it started to increase with a spike in the early 90s. Then it decreased again, and on the inset you can see, unfortunately, the number of cases are increasing again. And then the map of the United States shows where the prevalence by location. If it is left untreated, syphilis will have four distinct phases: primary, secondary, latent, and tertiary. Congenital syphilis is when a mother who is infected transmits it to her fetus. This can result with devastating results. It can lead to fetal death. If not death, it can lead to mental retardation and malformation. This picture is showing different areas of the body and some of the lesions that are caused by syphilis. For diagnosis, there's an antibody test that can be run. Tertiary syphilis can be somewhat difficult to diagnose. For treatment, penicillin would be the drug of choice. Prevention, abstinence, or safe sex practices. There are some species that are non-venereal. Oftentimes this will be seen in children in areas where there's unsanitary conditions and the living conditions are very poor. Can cause skin lesions. Penicillin can also be used to treat these. Try to limit contact with an open lesion. This is an example of yaws, which is one condition. Borrelia is another spirochete. There's two main diseases that it causes in humans: Lyme disease and relapsing fever. Lyme disease is relatively new disease. It is the bacteria is transmitted to humans by ticks. So once again, here you have another vector. Ideally, if you can prevent or stop that break of that vector to human transmission, you could stop it. Once again, these are also spirochetes, so this shows with the slide with the red blood cells, and you can see the spirochete in there amongst the red blood cells. This is just showing the life cycle of the tick. and how it does play that role as a vector. That you have the tick initially, it can infect birds and small mammals, and then the bacteria is multiplying in the larvae, and then the nymphs eventually, it's a couple year cycle. You have this passage of the nymphs feeding on animals or humans, and then they develop into the adult ticks in the second year. They feed on deer. The female ticks lay eggs, and then the cycle starts over. You'll notice on the inside of the arm that you have that bullseye scarring or rash forming. That is a classic thing with Lyme disease, is to see that bullseye type of rash. It's the tick that is the vector. If you see that bullseye rash, that's going to be at the infection site, you need to start treatment as soon as possible. If left untreated, it can lead to neurological problems, cardiac problems, severe arthritis that will last not for days, but for years. It can have a detrimental effect on the immune response. We are seeing an increase in the number of cases of this in the United States. What is the reason for that? Because humans are encroaching more and more on the habitat where these ticks are, which is out in the woods, and we're going out more and more into those woods. If we never cross paths with the tick, we would never get it. But we're encroaching more and more on their environment. The upper graph does show the increase in the number of cases in the United States, and the bottom map shows the location. As you can see, most of it is in the Northeast and then in the upper Midwest areas. So how are you going to diagnose it? Mostly on signs and symptoms. You can run blood tests. If it's in the early stages, antimicrobial drugs will be fairly effective. Later stages, it's going to be a little bit harder to treat. Once again, best protection is avoid those ticks. And some of you may be thinking, well, how can I avoid ticks if I'm out in the woods? Dress properly. Don't be wearing shorts. Tucking your socks into your pants to try to prevent the ticks from ever being able to come in contact with your skin. And once you get back home, do a check. Make sure there are no ticks on you. Relapsing fever. There are a couple of different types. Different species can cause different types of relapsing. One is transmitted by ticks, the other one by body louse. What's going to happen here is you have these repeating or recurring episodes of fever and septicemia. It's trying to get rid of it. And it's probably best seen with this graph, where on number one, you have your first exposure. You're going to get a high fever. It spikes. As your body is fighting it, you have your typical immune response, and then the fever is going to go down. About day 12. And then about a week later, here starts the fever again. This is what would be considered the second antigenic challenge. It's going to last for a couple days, and then it will come down. About day 20 through about day 22, the fever will be down. But then about day 22, it's going to spike again, hence the name relapsing fever. How are you going to diagnose it? You look at spirochetes, and then you can treat with antibiotics. Once again, preventative measures, avoid those vectors, avoid the ticks and the lice. Good personal hygiene practices. Use chemical. Excuse me. Leptospirea is motile aerobic bacteria. It's found in a lot of wild animals, domesticated animals. It can enter the skin and the mucous membranes. Once it gets in the bloodstream, it can go anywhere. It can cause problems with liver dysfunction, kidney dysfunction, can be treated with penicillin. Is it possible to eradicate this? Probably not, because there's so many other animals that can act as a reservoir. And this is a picture of what it looks like, which is really kind of neat, showing that classic spirochete in terms of the helical fashion of it. It's definitely not a bacillus, and it's definitely not a cocci. Vibrio is gram-negative. They have characteristics in some ways that make them similar to the enteric bacteria. They are found in the water pretty much throughout. They are rods, but they're curved. You have this classic curving of Vibrio cholera, which is the causative agent of cholera. They tend to be these kind of fat bacilli curved bacteria. As you can see, they also have flagella on them. I had a student a couple of years ago who referred to them when he saw the slide that they look like puffed Cheetos, which I always say use whatever helps you to remember it. Can't say as though I'd ever thought of it that way, and I really can't look at puffed Cheetos the same anymore, but use whatever works for you. These are pathogenic to humans. They can survive in freshwater. It's said that it is a causative agent of cholera. How do humans get it? Usually by ingesting contaminated food or contaminated water. Why is the food or the water contaminated? It's often found in areas where there's very poor water treatment facilities for human consumption and very poor sewage treatment. And sometimes in some areas we find that the sewage treatment may not be real efficient, and it is being discharged right near areas where you are obtaining water for human consumption. Not a good idea. If you become infected by ingesting, say, contaminated food, one thing that is very characteristic of cholera is what we call the rice water stool. It's a very loose stool, very high amounts of water loss because of diarrhea. Why you having this diarrhea is because the cholera produces a toxin. And so you have this severe loss of fluid. And you have to keep in mind, it's not just water you're losing, but it's also electrolytes. So if this is left untreated, the mortality rate is very high, unfortunately. You need to replace those fluids so the patient does not become dehydrated, but always remember it's not just the water. You have to replace the electrolytes. The idea is replenish water and electrolytes as fast as the patient is losing. This graph or table shows areas where there have been outbreaks, epidemics of this over the years. Cholera is one thing that we're often very concerned about amongst a lot of different diseases, but whenever we've had natural disasters like hurricanes that come through, and if the water treatment facilities are not operational, you want to get them up and running as soon as possible so you can have good, clean water. It is so important. You've already started to see so many diseases can be spread in contaminated water, contaminated food. If nothing else, if you can get clean water, good clean water to people, and not have them drawing their drinking water from where the sewage is being discharged, that will eliminate a lot of different diseases. So how will you diagnose the Vibrio? Usually by the symptoms, especially the diarrhea. Like I say, you need to replace the fluids, electrolytes. You can give some antibiotic drugs that will try to reduce the amount of toxin that's being produced and therefore reduce the amount of diarrhea. Prevention, proper sewage and water treatment. There are some other species of Vibrio which can cause similar symptoms like cholera, um, and also this is from ingestion of contaminated food. One problem that they often have is with shellfish, because like oysters have been known to be contaminated with Vibrio cholera, because oftentimes the oysters are harvested just offshore, and oftentimes it's in areas where communities are discharging their sewage waste. And for the oysters, it's like, oh, there's lots of nutrients here, but not so good for us. So just be careful of where the shellfish is coming from. There is a type of wound infection that can also be caused by a Vibrio. Basically, you're using contaminated water to rinse out the wounds, which you might be thinking is, hey, that's not a good idea. No, it's not. The flip side of that, if you have nothing else to use, you need to clean the wound. That's why it's happened. If left untreated, this can be fatal, but they can be treated with antibiotics. Campylobacter jejuni is one of the most common causes of gastroenteritis in the United States. A lot of animals can act as reservoirs, and then humans get infected by eating contaminated food or drinking contaminated water or milk. Oftentimes, poultry, chickens, turkey can be a source of infection with this. Infections usually are self-limiting. You have frequent diarrhea. How do you prevent this? Proper food handling and proper food preparation. Helicobacter pylori is a helical bacterium. It is motile. It can colonize in the stomach of its host. What happens is usually you ingest the bacteria from contaminated, possibly water. Something was contaminated that you touched, fomites or inanimate objects that basically are used as vectors. And what is going to happen, it is a causative agent of gastritis and also ulcers. What happens is it tends to be able to colonize in the stomach. Remember, the stomach is about pH 2, which inhibits growth of most organisms. What it does is it will produce proteins that will inhibit the production of the stomach acid. So that's kind of a nice little trick. The acid's going to kill me, well, I'm going to inhibit the production of the thing that's going to kill me. The flagella help the bacteria to kind of burrow down into the stomach lining to get away from the acid, where it's going to be more protected. And then it has adhesins which help bind it to the gastric cells. And then, if that's not enough, it produces enzymes that will neutralize the hydrochloric acid in the stomach. This is a picture showing in yellow what the Helicobacter pylori looks like. Commonly, we just refer to it as H. pylori, which is what many of you may have heard of before. And yes, like I said, it's causative agent of. In this diagram is to show you how it's able to invade down through that mucus layer that's helping to protect the stomach lining, the cells. And then it attaches to the cells, those gastric cells, and it starts to produce toxins, and it causes inflammation. And so then that layer of mucus gets thinner and thinner. And then once it is completely eroded away, then the acid, the gastric acid, that acid that's in the stomach, then starts to destroy those epithelial cells, the cells lining the stomach that used to have that protective mucus layer, but that was destroyed by the bacteria. And so now the low pH in the stomach, that acid starts to destroy your cells of your stomach, continuing on down, forming that ulcer down to where your arteries and veins are, and there's a break there. Well, that now allows the bacteria in. presence of pylori can be detected by doing a urease test, and if it's positive, you'll do additional biochemical tests to get a definitive positive answer and identification. You can treat this with various antibiotics. You will also want to initially start drugs that will inhibit the acid production so it gives time for that stomach lining to heal. Prevention, good hygiene. Wash your hands. Always wash your hands. Proper food handling. Adequate sewage treatment. So by now you're starting to see a lot of things go to what many of us would refer to or think of as just common sense. Good, proper hygiene, good washing your hand techniques, have a good clean water supply, and proper sewage. That can do so much for preventing so many of these various diseases.